Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas Wheeler, VACHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. We've got a great show for you. We've got Dr. Edna Gordon that's joined us today. And remember that you're here listening to the stories and conversations from the front lines of community health. And this podcast amplifies the voices of those who live in various parts of our country and Virginia, because we're coming to you from Virginia. And it's about people who care, and it's about the people who need the care. And so, Dr. Gordon, thank you for joining us today. We were so excited when we learned that we were able to snag you up and have a conversation with you today. And Dr. Gordon is very unique, listeners, because she is a physician that works in rural America here in Virginia. And remember, this podcast is about common voices from common people. And Dr. Gordon sees those kind of people every day in her practice. She works at a community health center, and it's called the Martinsville Henry County Coalition for Health and Wellness. And as we've learned in previous podcast shows, that her health center is considered a federally qualified health center in the state of Virginia. And what's also very interesting about Dr. Gordon is that she's been practicing for many, many years. And she really only looks like she's 25, guys. I just want you all to know that. But also, she's African American, and she doesn't fit the script, if you will, of what we typically find in rural America. So I think that's what makes this show so very special, and having Dr. Gordon on and talking to her about that. So Dr. Gordon, let's get right into it. So how long have you been practicing now?
For roughly 20 years.
20 years. And listeners, believe me when I tell you, she looks like she's younger than me. Okay? I mean, she looks amazing. And so what made you get into medicine? Why medicine?
My story is a little bit unique. I have parents who were both advocate. Big focus was on education. And my dad specifically did not like for any of his children to come home from school and just, move towards the TV or watch TV. So in other words, he encouraged us to either do volunteer at different places and or read. And at the time I hated reading. So I decided I would volunteer. And the options were, volunteering at a shelter, volunteering at community centers, and or, in my case, I saw to one of my counselors at school who said, "Hey, there is a volunteer services at the hospital. Would you like to do that?" And I said, sure, because that would get me away from home for a little bit, and my dad would not be on my case. So that was how I was introduced to medicine. I went there with the idea of, okay, I'm going to volunteer, and I actually enjoyed helping people. And at the time, it was a little bit different because I was almost, as a teenager, a little bit self-centered. But then I found myself doing things, and people were very appreciative of that.
Mm-hmm.
So that kind of encouraged me to kind of move along that course.
So how long have you, actually, I'm going to step back. So you're in medical school.
Yeah.
Then you do your residency. Did you always know that you wanted to be a primary care physician?
No, what I did know is I wanted to help people. And that was just the focus at the time. And for me, that help, medicine was one of the channel that I could do that. I was also, well, I excelled in science and math, so that was not a big, obstacle to overcome. But I think the bottom line is I wanted to help people. And that was just the focus at the time.
So, how did you end up at Martinsville?
I think it's by default. And it's a good thing, by the way. So my brother went to Chapel Hill, and I would visit him during my residency. And I said, "Wow, I like this area. It's kind of quiet." I was coming from Maryland, metropolitan, and I kind of like the Chapel Hill area. So fast forward residency, I was looking for a place in Chapel Hill, and the recruiter steered me to Martinsville and said, "Well, it's kind of close to Chapel Hill, but let's take a look anyway." And I came to Martinsville, and I literally fell in love with the place. It was small. It was kind of like a close knit of people who were generally very nice. It was kind of a different thing that I was not used to. And I say this now, and people from Maryland will look at me like, what's wrong with you? And I say this, but there is that, people from the rural certain, they were very caring. They were very appreciative. Just coming to town, I would not even know anyone. I'll walk into something and people will stop to say hello. They will, and if I look different, so they'll ask questions, where are you from? Where did you grow up? And then they'll mention little things to me that seem very, welcoming is the best way to say. So when I came through here, kind of the same. I had a very warm experience with the hospital staff. And at the time I had two young, I was actually pregnant, but I had a very young daughter at the time, less than 2 years old. And I had people coming to me and saying, "Hey, if you need help with babysitting, I'll be more than happy to help you with that." So you almost felt like you were home. You had people who were embracing you, people who welcome you. At the same time, you almost look at it like, is this real? This is not, you're coming in to help others, and you find that they're actually helping you.
Right.
So it was a kind of perfect union. And I've been here since then.
So you've been there, how long in the community there?
So about 22 years, I guess you can say that.
About 22 years.
Yeah.
So since the time that you've been there, began there, to where we are today, have you noticed any change in the community, in their perspective? Even with some of your patients, have you noticed anything changed?
Yeah, quite a bit actually. So when I first came through here, you did have the furniture companies and other, sources of employment. People did have access to insurance at the time, and those have certainly dissipated since I moved here. So it's changed in the sense that, well, it may seem like at the time a very thriving community that had, working class people who actually, were able to make, some money, take care of their family, having health insurance, all those left. And now we are left with a community that, clearly, besides just an employment factor, there's also a health risk that comes along with that. So we've seen demographics of, people either moving out, less people coming in at the time. That clearly may have changed now, but I think the access to care, access to being able to afford care, has been a challenge since I moved down here.
Does that impact your practice and how you're treating your patients? Given, because it sounds, it's really around. That their social determinants, right, are impacting health centers and their delivery of care in the rural setting, right? And so that being said, how are you using the change in the community to take care of your patients?
A couple of things, and I know this is something that, in coordination with the community leaders, there's always things like free clinic access to get people to come in to have basic things done. The other thing that we've put in play is, some of the challenges that we face is transportation. In the setting that we are in, there's no public transportation, so people rely on, private vehicles. So we are looking to do things differently. And what that means by that is that occasionally we have to set up what we call mobile clinic, where we actually take the delivery to the patient. And we set it up, and there's an announcement made and in a central location that people actually can get to it. But I think you have to find somewhat of a unique way of delivering when you have a challenge with all those shortcomings. So you find ways to deliver healthcare differently. Is, I guess, the best way to say it. We still have our community clinic, and I think we address things a little bit different than maybe a more metropolitan will. We are more forgiving, and when patient calls and tells us, "Hey, I can't make it for whatever the reasons," we have other ways of communicating to address their health needs. We have, telephone encounters where we actually call the patient, engage to see what is happening to them. Is there a way we can actually get to them? And if not, we can get a dispatcher to get to them, bring them to us, and we'll do the assessment. So we find a unique way to address all those challenges as we go along.
One of the things that we learned is that right now, under COVID, we're under the Public Health Emergency Act. And we understand that should the Public Health Emergency Act expire, there are some things that used to be available to the health centers and to providers like yourself may not be available after the Public Health Act goes away. One of those things, from what we understand, is being able to deliver healthcare services virtually through telehealth, via video or audio. And so we've learned that audio is one of those areas that may end up going away. What would that do to your patient population if you're not able to? Certainly it's not ideal. You obviously want to be able to see and touch your patient, but because of the transportation issues, I get that it becomes a challenge for your members. And then, of course, there's the internet challenge as well, being able to access internet. But I'm sure you have had to deliver some kind of service via audio. So if that audio piece goes away, what does that do for you and your patients and the services that you provide?
I think it will become a big challenge. And to be honest, we'll have to look at ways we can address those challenges. It's been what we have done, which sometimes work, is that we find ways to accommodate the patient. So in a sense that if a patient who has an appointment and he tells us, "I can't get to it because of transportation," and we will find every effort to try to see when we can get that patient in. I think the ideal situation is we can do the telephone encounters, but if that doesn't work, we say, "Okay, when can you come in?" And if they tell it, "Well, no, I can't get here till after so and so," we will find every means necessary to make sure somebody's there to address those needs. At least this is part of our goal, that we don't turn anyone away if they come in late, if they come in for whatever their reason, because we do understand the challenges. We'll find every way to try to accommodate them. So that's what we continue to do.
So are some of the what would you say is some of the biggest challenges, if you will, for rural America? I know you talked about transportation being a huge barrier for your patients. What other things outside of employment as well? What other things can we tell our listeners about rural America?
I think also understanding their health risk. Certainly, what I see is there's a big push on some of those risky health behaviors that I think sometimes when you are brought up in a certain community, there are certain things that seem to be the norm. And as we know more through research and technology, we know those behaviors that clearly put people at risk for bad health outcomes. So we try to just basically do some education. The other thing is access to, subspecialty or specialty care. Those are a big challenge that we face as well. And also patient being able to understand what you are telling them about their health. Part of the challenge is you can tell somebody that they may have, let's say, hypertension, but that don't mean much to them until they understand the risk associated with having an elevated blood pressure, and being able to basically educate and or even just enlighten them with what that means. And the good news is that most patients are quite receptive to hearing those things. So they really want to understand why something is important to them. Things like diabetes, education plays a key role in trying to get someone to understand why a hemoglobin A1C level of this is better than 9, or what challenges they face in getting their medications, and try to accommodate those shortcomings. But those are the biggest challenge: health risk challenges, behavior challenges, access to subspecialty or specialty care. And the other thing is understanding of their health risk. Those are, and that's been one of my biggest challenges. You have a patient who may have several predisposition and underlying health, but they do not really understand the impact of those health problems.
So, Dr. Gordon, as I'm listening to you go through what you shared as far as some of the challenges that you're seeing there in rural Virginia, what is it that our listeners who live in the city or the big city and have all the kinds of access to subspecialists like you had mentioned, what is it that you would want them to know? Or what is it that you would love for them to be able to do to help you and help your patients and the communities in rural America? What would be that wish list for you?
My wish list would be actually the perceptions that people have of rural America. I mean, I think it's a wonderful place to be. But also, I think one of the things I've been able to appreciate here is that people actually are grateful to every opportunity they have for somebody to engage with them about their health conditions. They'll make small changes. They will make those changes and be happy to share those changes. I think it's important to understand they are no different from people coming from, the big city, except access is the biggest limiting factor, transportation being some of the challenges. But overall, I totally enjoy working here. I enjoy my patient. They listen. They're willing to come back and share some of their small successes they've had. And I think it's also helpful to walk with them in their challenges, maybe not necessarily understanding all the impact of what they are going through, but being empathetic and being there to walk with them through their small successes is a big plus.
I started off, listeners, by talking about Dr. Gordon and the simple fact that she works in rural America, but that she's an African-American woman who lives in rural America. And it sounds to me you raised your children in rural America. Is that correct?
Yes. And they will tell you.
What would your kids say?
They get to be a little bit culture shock when they go to a certain part of the country that their other, nieces or nephews live.
That look like them.
Yes, and they'll come. Well, I'll put it this way: I had my daughter went to Florida for school, and she came back home. She wanted to stay home and do her graduate, so she had a little taste of
Mm.
what it's like to be in the big city, and then she wanted to come back home. So
Why?
that
Why did she want to come back home?
she'll give different reasons, but I think she misses. So I give her instances where I would tell her that, one of the reason why I love living here is I can wake up and the only thing I will hear is birds and deers running around. If I was in a big city, I'll hear ambulances or cars, and I don't like to hear that. I like to decompress. So for me, and I think she had a taste of that, and she missed just getting up in the morning and just looking outside, and all she sees is maybe a deer or just quiet and peace. And I
Hmm.
think there's something to say about that.
Do you think that what is it that you would say to a young resident who is African American looking to find a place to practice? What would you say about how would you convince them to think about rural America? That's the first thing. Then the second thing is we talked about how you work at what we've learned as a community health center. And so, what would it take to convince a young African American physician to think about coming to rural America at a community health center?
What I would say to them is that you clearly would want to have your priorities in the right order. For me, it's caring for patients. And if that is your focus, then this is the place for you. Um, if and I know there's other factors that go into play. However, I think if you're looking for a place where one, you get to take care of patients and they actually appreciate every single treatment plan that you have for them, this will be the place. If you want a place to come to where you feel more rewarded, put it that way, and I do. I think the greatest gift I have is that I take care of people and they're appreciative of what the work I do for them. And that is to me much more rewarding than anything else. But I think the focus have to be, I want to take care of patients. I want to treat patients. I want to see the reward of taking care of patients. I want to see the outcome of what my treatment plans are. And to me, that speaks volume than anything else. And if that's what your focus is, then I said, this is the place for you because you are going to love it. You're going to enjoy doing it, and you're going to have all the support available for you to take care of those patients.
When you get a new patient, and that patient looks very different from you, are they still very accepting of you?
So that it was a little bit of a challenge when I first moved here. And I had a lot of patients actually thought I was, well, would call me a nurse when I still had my badge on and addressed myself as a physician. And then occasionally I'll have the ones who will just look at me and say, I don't know about this, but I think after being here for so long, and most of the patients who have seen people who look different from me, but they've seen my work with them. Yeah, I have some who come in and specifically will say, I want to see her. I don't want to see the other person. I want to see her instead. She took care of me, or she took care of my dad, or she took care of, and she did a good job. So I want to see her. And that is something that I think it comes with people just feeling comfortable enough about what you're doing for them. And occasionally I do have the ones who will look at me because I look different and they would make statements that seem very inappropriate. But I look at it in terms of just an isolated case and don't look at it as the majority of people, because the majority of the people who come to me actually are people who does not look like me. And
Yeah.
majority of them are quite appreciative of everything we do for them.
You know, I would be remiss if I didn't talk about the times that we're living in as it pertains to this pandemic. And
Yeah.
I'm curious to hear what has been the Martinsville community, what has been their response over the last couple of years to COVID? Um, and your conversations with your patients with regards to, I'm sure you've had conversations with them about safety measures and options to consider to help minimize or prevent them from getting COVID. What has been the response from the community there and your patients?
I think in the initial phase of the pandemic, there was a lot of anxiety in the medical community as well as the general community. As we've learned more about COVID in terms of the treatment options, I think for the medical community, it's a lot better. For the patient, I think what I've experienced, I guess, over time is what they hear, what they watch is clearly not what is happening in our community. So I try to give some reassurance. A lot of images from either social media and or TV certainly does not speak so much of what has happened on the ground here. So the biggest challenge is trying to, one, reassure them and letting them know that we are here for them. I think there's quite a bit of anxiety early on, so and naturally so, because this was a pretty serious disease that we all faced. But for the ones who end up going home, when we see them, we try to reassure them, and we always tell them, "Hey, come back. If you feel differently, we can always reassess and see where we are. These are the treatment options. This is what you need to do differently." And if any of those things changes, let's reassess you. And those are the ways we combat this. For the most part, we've had some anxiety over taking the vaccine. One of the fortunate things that I've had is actually educating people how important the need for the vaccine is and how clearly how that will impact them long term. So some of the things that I've done is actually showing them pictures of x-rays of what a COVID lung x-ray look like and how that impacts you when that happened versus taking the vaccine. And I was in the forefront of taking the vaccine myself. And I'll tell people why I took it. I tell them I would do it without a question because one, it is important to protect ourselves as well as our family members. So little things to just kind of give them reasons to think a little bit before they make those leap to take the vaccine. And also the ones who do not take it, I think, again, for all the reasons that they will have, we still want to make sure we give them the best care when it's necessary. And for that, we give them those options at the time when monoclonal antibody, we made sure that those patients with all those risks and who were a little bit more, had severe symptoms, they had access to the monoclonal antibody, and we actually would set this up for them to make sure they get it, whether they did or did not have insurance. So it's been a challenge. I think the key thing is education and make sure that we all had the questions answered when they do have questions. And, some people have some still anxiety over the vaccine. And we'll bring that subject up again the next time we see them. And we'll talk about it. We talk about, again, how important it is. But I think just like anything else, we have to set examples for our patients. So we make sure that almost all our staff members are vaccinated, because if we are talking about it and some of our staff are not vaccinated, that certainly does not speak volume. Again, our patients, for the most part, when you do engage with them, they'll usually come back with either questions or they'll say, "Okay, I'll think about it the next time I see you." And that is good enough.
Well, it's interesting as I'm listening to you describe, the feedback that you're getting, from the patients in the community. It doesn't sound any different than me or, other people in big cities. And, we all have anxiety about getting COVID,
Yeah.
and that we really We really need to not listen to, what they're saying on the TV as far as people's perception, and actually have conversations with individuals like yourself who are actually living in these communities and actually treating the folks, but then also even some of the people who are living in the community and actually listening to them. Because that's the one thing I'm hearing from you, is that what's critical is being able to listen to them and their anxiety over the disease, and then being able to answer their question, but then still giving them the space to make the decision as to what's best for them.
That's correct.
Well, Dr. Gordon, this has been amazing. We really appreciate you taking the time to talk with us and share really, what's going on in rural Virginia. I think it was really important that we let our listeners know that, you can get good health care, not just in the city, right? You can get it
correct.
in Martinsville, in Martinsville, Virginia, right? And you've got providers such as yourself, no matter what you look like, providers such as yourself are able to deliver good healthcare services and are committed to the community and ensuring that those services are provided. And at the health center, we hope one day we can have a conversation with your CEO, Marcus Stone, because we'd like to learn more about the health center itself. And we heard why you were attracted to the health center, but certainly I think it's worth us and sharing with our listeners more about the health center. I do want to ask you before we let you go, if the health center was not there, where would the citizens of that area go for their healthcare services, and how long would it take for them to get there?
That is a very good question. So with some of the challenges due to employment and access to healthcare, it is going to be probably quite devastating in terms of the health risk. And as you all know, when it comes to healthcare, when prevention is one of the key things to avoiding all the later complication that ensues with not having access. So that is a good question. I would say years ago we did have free clinic that was gave some outlet to some of our underserved communities. Those have somewhat dissipated. So you know what? It is quite important, but I guess when you do have something, you just don't think about what ifs. Yeah. And I'm hoping that it never dies down because the community do need this. They thrive just to even have access. One of the things that we struggle with, we don't even have a lot of family physicians here. Mm-hmm. So the community, just to have access to have a provider, whether it be a physician or a nurse practitioner or a physician assistant, that is just it will create an unwanted disaster in this community if we did not have that access.
Well, and one of the things we do know, and I always, when I've learned more and more about what community health centers do, and you talked about the community and how it's a very giving community, it's an open community, it's a beautiful area, it's quiet, you like waking up and hearing the birds and just be able to decompress. Well, to me, I would think that would be a place like somebody like me would want to come and visit and maybe spend a few days there. But then if I'm there and God forbid something were to happen to me and I didn't have the Martinsville Health and Wellness Center to go to, where would I go? And, so even though you may not be my healthcare provider, I know that, you would see me no matter what my ability to pay is, no matter what I look like. And if I were visiting I could rest assured that I would have your health center to go to. So those are the kinds of things that I think we, as individuals in America, we have to remember that. So, thank you for the work that you're doing. And I hope you stay in Martinsville. So when I do come and visit, and our listeners come and visit, that we can come in there and say hello to Dr. Gordon. Dr. Gordon, thank you for your time, and please continue to do the good work that you're doing. I want to thank my guests for joining us today, and thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas Wheeler. Thanks again, and I'll see you next time.